Hi, my name is Vikas Upadhyay. I'm a PhD student at Indian Institute of Technology, New Delhi, India. Today I'm going to present my case study on improving accessibility of a healthcare facility in low resource setting. My co-authors are Tigmanshu Bhatnagar, Catherine Holloway, and M. Balakrishnan. So I would first like to give a brief background. This case study is based on a wayfinding and service design experience which is carried out at a mega ophthalmic care facility, which has a footfall of 2,500 visitors per day. Visitors to this ophthalmic care facility include a vast diversity including social, economical, physical, and educational background. One more important thing to note is the operation of an ophthalmic care facility is very different from other regular clinics, because here we notice that visitors have to go through multiple touch points back and forth, which makes their journey even more challenging. So to assess the patient journey, our first visit to this hospital facility was very confusing. Hence, to evaluate the visitor journey experience, we conducted a mixed set of studies. To simulate the visitor's journey, we perform an immersive role-play task. This helps us to understand the pain point in the patient journey. After this, we conducted an observational study which helped us to prioritize the information and accessibility requirement for the visitors. We also engaged the hospital staff, including patient care managers and doctors, through informal discussions. Our objective was to understand the nature of query asked by the patients and the key challenges from their perspective. So based on these studies, we were able to derive the patient journey experience at various touch points during the whole journey. This figure shows these experiences from very good to very poor. It has been represented through different colors throughout the journey. Based on these, we can summarize the patient journey experience into some key challenges. There was a significant lack of wayfinding and healthcare information and accessible medium to communicate these information. There was also a gap between the communication between the staff and the visitors. This conclusively resulted into delay, stress, and suboptimal treatment, or even sometimes a complete lack of treatment for the visitors. Hence, to improve this, our hypothesis was to include a spectrum of solutions in a progressive manner. These solutions include a physical, manual, and digital interfaces to cater a vast diversity of these visitors. Okay, now let's see how we improve the journey experience for the visitors. So we first implemented a set of physical solutions, which mainly include signages and design of a new patient registration card, which include consultation related information such as doctor's room number, their dates, and their timings. We also implemented a digital application over a smartphone and a kiosk application to support visitors with having a smartphone. We used a QR code over the registration card for patients to access the route information and other healthcare services, and for the hospital to update the patient status in the centralized database. A closed loop information delivery, update, and tracking mechanism was implemented over the centralized database. Let's see more detail about these interventions one by one. Let's first look at the physical intervention. This mainly includes 4 types of signages: wayfinding, nodal, directory, and the information signages. To reduce the cognitive load and create a seamless experience, we followed strategic placement, progressive disclosure, and reassurance principle. We also introduced a smart registration card, include a QR code, which is linked to the medical record division. And the patient assistance application over a smartphone also use the same QR code to provide route information and appointment booking. The QR code has been used for other digital intervention, which we'll discuss next. Now the digital intervention include the application and the web-based kiosk application. Now the digital intervention include a mobile and a web-based kiosk application. The key healthcare information and service provided over these interfaces include appointment booking, wayfinding, expected waiting time, and any needful information which patient required can be recorded over these interfaces. We prioritize these services and the information need based on earlier studies. Our evaluation results found that visitors prefer to use signages over any other medium for wayfinding. And to access the healthcare information, visitors always prefer digital mediums and the kiosks. Whereas to accessibility related information, visitors predominantly prefer the human assistance. Even after getting the information from alternate mediums, visitors again prefer human assistance for reassurance. These evaluation results clearly indicate that multiple mediums must exist together and should be in consistence with each other. Now, the key inferences we can take that the preference of a medium always depend on ease of access, type of information, and the ability of user. The detailed analysis of our evaluation result help us in possible selection of user profile, healthcare information, and medium to communicate these information. So based on our learning and engagement over a period of 18 months with hospital staff, patients, and visitors, we propose a design recommendation for physical, human, and digital mediums. One can look into our paper for more details. A summary of these recommendation for these mediums is presented in this slide. We believe these recommendations will be useful to a wider community operating in the similar setting. In conclusion, to support these recommendations, we suggested a design architecture that can have 3 distinct layers of information over multiple medium to make information easily available and sensible to the visitors. We are open for suggestions, discussions, and collaborations to develop these recommendations further. I will conclude with this. Thank you very much.